Chairwoman Friedman, Chairman Long, members of the Joint Committee on Healthcare Financing. My name is Dr. Andrew Hyatt. I'm a resident physician at the Cambridge Health Alliance. I'm also a proud member in the Massachusetts Regional Vice President of my union, the Committee of Interns and Residents, a local of SEIU. I'm pleased to offer testimony in support of an act establishing Medicare for all in Massachusetts, HR 1276 and S766. So as a union, we bargain collectively with our employer, CHA. Right now, we've been in the midst of negotiations for several months, and one of the biggest sticking points has been healthcare, especially access to mental health care. In a system where we depend on our employer for healthcare, we have to spend a great deal of time and effort to ensure that our fellow resident physicians who are taking care of some of the most vulnerable patients in the Commonwealth have adequate access to the care that we need. This is energy that could have been better used to negotiate over other pressing matters like fair wages, sufficient resources, and decent working conditions in which we can better deliver care to our patients, to say nothing of trying to care for others while worrying about what would happen if we were to become sick ourselves. This is why healthcare needs to be taken off of the bargaining table, especially in the middle of a pandemic and a mental health crisis affecting doctors. We shouldn't be forced to negotiate over our healthcare. Healthcare should be a human right, not a bargaining chip in negotiations with our employer. It also speaks to the way that hospitals cannot solve this problem on their own. If my employer, a health system itself, cannot figure out how to provide affordable, quality healthcare to its employees, how could any employer in the state do so? Our current system also considerably restricts where we can seek our care, forcing us to forego providers that don't accept our narrow network insurance. As I've mentioned, we're still fighting over healthcare negotiations, and the main sticking point is ensuring that we have access to mental health services outside of our hospital. I'm proud to work in the psychiatry department, but it's not hard to see why myself or my colleagues would not feel comfortable seeking mental health care from our supervisors and our coworkers. As a psychiatrist, I know that to ensure people don't end up in crisis, we need to make sure they have access to primary and preventative care without fear of cost or stigma for seeking care. Single-payer Medicare for all system would be an infinitely better system for our members and for all workers. It would provide workers greater leverage at the bargaining table with which we could achieve greater support and protection in the workplace. It would also simplify and streamline our process for accessing care, improving access to care, and removes the fear of bankruptcy that has kept so many of my patients from seeing me after losing a job or losing insurance. It's time we take this step. We can't wait any longer for federal action on this issue that never seems to materialize. Today, I ask the committee before me to support H 1276 and S 766 and to report favorably out of committee. Thank you very much for your consideration.